Our speakers today will be Alex Lennon, who will share valuable insights on how to maximize your 2025 tax returns purchasing equipment this year, and Dr. Brad Lebrecque, who will discuss how to successfully integrate lasers into your practice to generate ROI. If you have any questions during the presentation, please write them down on the chat box, and I'll make sure to read those after the presentation is done. Our first speaker will be Alex Lennon. He works at Envision Capital Group LLC. He's going to be talking to you today about Section 179 and bonus depreciation. Alex is a senior vice president for 23 years in finance and 5 years focused on dental lending. Alex, the floor is all yours.
Thank you all, and thank you to BIOLASE and everyone for attending. Really, I think the biggest thing as we go through this, you're going to notice is that Section 179 and bonus depreciation are two completely separate parts. And so through the presentation, you're going to see we address them separately. And then at the end, we'll talk about how to maximize them together. So next slide. Do they show I feel like we see that.
I'm on slide section 179.
Okay. So for some reason, I apologize. I can't see it on my side. So section 179 allows for businesses to take the full depreciation in the first year in service. Now, you can also set it up over multiple years, but most businesses, whether they're a fresh startup and or a seasoned business, like to take it within the first year because there are other depreciation, there are other things that can take off throughout the years. Section 179 was really designed to phase out, but they do allow for a bigger depreciation up front. So what I mean by phase out is every piece of equipment, whether it's a hard cost or a soft cost like software, stuff like that, has a lifespan. And so with Section 179, you're allowed to take a portion off every year or take a big deduction up front. And that's what a lot of people will do. I think the biggest difference you'll see with 179 is that it cannot create a net loss for your business in the first year. And again, I'm not your CPA or your tax advisor, so please consult with them, ask particular questions, but I'm more than happy to help walk you through that as well. Next slide. The next slide actually goes through bonus depreciation. Again, this is a completely separate depreciation that they've allowed. And bonus depreciation has been around for a while. And in fact, prior to this year, about 2 or 3 years ago, it was at 100% and then phased down. So last year, it was at 40%. Well, what you're going to see is due to the beautiful bill that passed this summer, they actually increased that back up to 100%. So bonus depreciation is an additional appreciation that lets you pull out the complete cost of the equipment all up front in the first year, which is a really good thing. On top of that, it is set for 100% this year. And unlike Section 179, Section 179, I forgot to mention this, I apologize. Section 179 actually goes off your in-service date, right? So if it's in service in December, you can write it off this year. Well, 179 is great for that. However, it has its limitations. Bonus depreciation actually lets you take it for depreciation when you're in contract, when you buy it. So in some cases, it doesn't have to be installed or in service, and you can still take that full depreciation for the year that you bought it for this year. That's a really big thing. Next slide. And now you're going to see, how do I maximize that? How can I go in and take advantage of the Section 179 and combine it with your bonus depreciation to allow you the best of both worlds? So Section 179 has its limitations. And when you meet those limitations, you can go in and take full advantage of 100% bonus depreciation for this year. The big takeaway is bonus depreciation can cause a net loss for your year. So what happens is when you talk to your CPA or tax advisors, they'll generally tell you, you probably do it around the first part of the fourth quarter, say, hey, you have this tax bill coming up. Let's use some capital to lower that bill. And that's what this is. So with bonus depreciation, you're actually allowed to cause a net loss for that year, which can be carried into the next year. So while you can take advantage of that for this year, you can also carry that loss into next year by combining the two, which is a big deal. Next slide. Now, a couple of things that I always like to look at is how can we use that in action, right? We know that we have two different deductions we can use for 179 plus your bonus depreciation. But what does it mean for you, and how can you utilize it, whether it's a hard cost, a soft cost, whatever it may be? How can you utilize that in your practice to make sure to maximize your dollar for this year? So here's a great example. Looking at $105,000, you're going to be able to write off the full amount of $105,000 and carry that in. Let's assume that you have a tax bill for 105, you'll be able to bring that to a net zero, or carry a negative 105 next year, which would cause a net loss for you, which is a good thing when it comes to income. Now, through this presentation and through BIOLASE, we are running an example here at 60 months at 4.5%. So it's 4.5 to 495, obviously on approved credit. But that would actually yield you a payment of $1,900 to $2,000, $1,916 to about 2012. Now, oftentimes, clients are wanting to utilize the purchase. They want to go in and, hey, I want to go ahead and take advantage of the taxes. I want to make the acquisition. I really don't want to make those payments right now. I want to reach the rewards from get the benefits from the deduction and push off my payment limit. And we can do that. We can do what they call a deferral. And what that will do is that would give you $99 payments, so 90 days. So you can put the technology in your practice, utilize it, learn it, market it, be able to cash flow it. And that rate right there through BIOLASE is 5.125 to 5.5 depending on credit. So for the first 90 days, you have a payment of $90 or $99. You get the technology, you write it off, it cash flows for you. And your payment there is $2,017. It's a really good deal to get in, whether it's a hard cost, soft cost, even combined to do that. Now, next slide. We want to show you and introduce you to the doctor, show you how this can be added to the practice.
Thanks, Alex. That's great. I mean, just think about it. If we can actually write off the darn thing. Right. I guess we all are making so much money. We want to make sure that we can actually not have to pay it off to the government. So introducing myself is I just made it basically a passion of mine for the last 35 years to use technology in my practice to its advantage. One of the best technologies that I've worked with and a good place to start with, because basically to get going, is a laser. I enjoy it. I think it's great. And so I just wanted to give you some clinical tidbits on how this can happen, how we can make this happen and work from month to month, so that you're looking at that $2,000 bill going, oh my God, how am I going to pay? How am I going to make any money? Do I need it? Can I do it? Let me just show you some examples. Javi, next slide, please. So how will it make your passion grow? Well, a lot of us in practice we're mailing in the house, let's say we're doing something, we're doing same-day crowns, and we run into a problem. We're working on tooth number 30, distal, drops in it, we've invaded biologic width. What are we going to do? Are we going to refer it out? We're going to have to stop the procedure? Can we not do that? Or can we do it in-house? Well, if we could do it in-house, How can we still get the crown done the same way? We can by keeping control and doing it minimally invasively. Laser technology, specifically an erbium laser technology, not a diode, which is a soft tissue laser, but an erbium laser will help us remove bone to biologic width to allow us still to scan the same day. So now you've done a bony crown lengthening procedure. And think about how many of those in the last month that you might have had an opportunity to do that for. How's your perio department looking? Are you treating periodontal disease? Periodontal disease is something, oh my God, we are the first people to see it. We're the ones that can determine whether or not you have it or not, and when should we start to treat it. Do you feel as though that your hygiene department does it adequately at more than 5 millimeters in the pocket? You know that if it's a 5 millimeter plus pocket, our piezos don't make it in there. We leave calculus behind. And so what do we have to do? We have to go in there now, pull the tissues away from the teeth so that we can actually see where we want to take our curettes and our scalers. Well, how about if you didn't have to do that? How many of you would actually want to go and have periodontal surgery to begin with? So if you don't want it, because I know not a dent, when I'm teaching and lecturing, nobody puts their hands up and says, I can't wait for flap surgery. So we can treat mild to moderate. These are people with 5, 6, 7, up to 8 millimeter pockets. We can do those in-house, same day with the surgery of Waterlase at the same time. Are you doing ortho, or maybe you're not? Are you doing sleep apnea? Maybe you are, maybe you're not. Maybe you have poor tongue position because of it's too tight. Maybe you have a frenum that's pulling too much. Again, traditional surgery is so invasive, and then you have to suture it and do all these things. In this case, you don't have to. So now we can control our younger patient base. If you have patients, if say you're doing Invisalign, you have a collapsed arch and you want to be helped with expansion, not only with appliances, but releasing the tongue is useful to help release that tension in the area. You have patients with migraine headaches. A lot of times they have a tight tongue. You check that over, release that, and then their migraine headaches go away. So there's many, many advantages to do these things. But again, none of us when we're trained in it to do the surgical technique where it's bleeding all the time, now we can do something that's not bleeding. And we can see what we're wanting to do at the same time. And another option as well is endo, because a lot of us are doing endo, or maybe you are, maybe you're not, maybe you don't like to do it. But let's say you decided you wanted to. Up till now, the best way that we've been doing it is we're using sodium hypochlorite, EDTA, and rinsing the canals. So we've had other technologies come up and come back and forth to help us get to where we want to go. But sometimes we have to do retreats. Why do we have to do retreats? Well, we didn't remove all the bacteria. Why didn't we remove all the bacteria? Because guess what? We left it behind. We know, and if you all remember, and if you're dentists on here, a book called Pathways to the Pulp. That Pathways to the Pulp told us that we have to basically agitate sodium hypochlorite in the canal for 30 minutes just to get about 50% disinfection in the canal system. Only 50%. If you went for surgery and they said, oh, guess what? We're only going to clean it out halfway. Would you be happy with that? Do you think there's going to be a high incidence of repeat? Of course you will. Now, if you take a technology that we have learned, and the erbium Waterlase technology has shown us that now we can remove up to 99% of the bacteria that's going to cause a retreat in the canal, and we can do it same day, one visit. So at that point in time, in my practice, what we're doing is that when we're having to deal with an endo and a crown, and then we can get the endo done, we can place our buildup done, we can prepare our crown if we have any areas that need to be, if we've invaded biologic width, we correct that, get our scan, and place the crown the same day. So endo is faster, crown lengthening is an add-on, and manage from there. The last thing that I'm going to bring up to you as well is just to let you think is if you are having implants placed in your practice, you know that we get failures. If we get failures, we have to know how to treat it. We have to keep the bacteria at bay and keep it away because we know how fast bone can be lost. So again, laser therapy allows us to maintain low bacteria in the canal. I mean, in the sulcus, pardon me. And at that point, maintain the integrity of the implant for many, many years to manage from there. So if you're doing implants, you are going to have failure. And so you want to be able to control it. Next slide, please, Javi. So that sounds like a lot. But okay, so Alex has talked to us now and saying, hey, we can put you on this program. It's going to cost you around $2,000 a month to manage it. Well, how am I going to bill out $2,000 a month? I don't know if I need to do that. Let me just show you 3 simple things that you can do. Procedure number 1. A lot of us, this is a basic restorative procedure. You look at that going, oh, I can do that with a burr. Yeah, we do, but most of the times when you do it, they fall out. Why? Because the burr removes enamel that we need to bond. It cracks the enamel as we remove it. And so it doesn't give us we're losing the ability to have a strong bond. In diving in with this laser technology, we can remove enough tissue where it's broken down into the dentin area, maintain the enamel in the ring of enamel, which is important, and place our bond. They just don't come out. You know, I used to do this before this with an inverted cone, number 35, a half round burr, try to remove all this at the same time. At the same time, if the tissue is hyperplastic around there, we can recontour it. This type of procedure, when we're doing it, can all be done without anesthetic. This is hugely important. In the anterior zone, even class 3s can be done without anesthetic. Why? Because as we're working with the laser, it is starting to cause some desensitization of the pulpal tissue. And again, at the point in time is that we can go ahead and do our procedure comfortably for that patient. So this gives you an idea. If you're doing 6 surfaces, which I normally do at this point, at a 2-surface restoration and using proper coating, that's about a $1,500 procedure. And that will take me about 15 minutes, sometimes 20 at that stuff. But again, a very quick and easy aesthetic type procedure. Next procedure, number 2. Crown lengthening. Yes, you are going to end up doing at least 1 in a month. Really, seriously, if you're doing any crowns at all, we're going to run into the same problem. You're milling, and you want to make sure you get that. You've got invaded biologic width. What am I going to do? Here I am. We have the laser placed and remove just enough bone so we can see our margin. But guess what? We can control hemorrhage. We can control hemorrhage. We can still get your scan. Now that procedure takes you maybe about 10 minutes of total chair time at that point. And so at that point, and still getting your scan, it has saved you another appointment. And that appointment can be done if you don't have to wait 6 weeks to bring them back in, or you don't have to send them out to your local periodontist to have that taken care of. So that is about an $800 procedure. Next one. Number 3. Oh, too fast. Now you gave away the hint. Frenectomies. If you have a lot of us frenectomies, tongue releases. I brought this one up. This is a fun patient because she was starting to lose attachment. We wanted to manage it. We wanted to get rid of the recession that was starting. She had multiple frenum pulls, so we just did them all in one day. Heals up very, very quickly. And once the pull is gone, with the techniques that we use with the Waterlase, we get minimized reattachment, which is different than working with a diode. A diode, again, we have to respect biologic width, respect the bone. So we can't go as close to the bone as we can with the Waterlase and the erbium laser. We can go right down to the periosteum to cause the release. Again, no sutures to follow up at, heals very, very well. Okay, just one frenectomy, and that's all we charge in here, or one tongue release is about $575. Just taken care of. If you are into children and even newborns and managing it from there, there's a great opportunity for people in dental offices to get in touch with the lactation societies, because then lot of babies can't latch on. And this is a much better route than having the pediatrician snipping it with a pair of scissors. We can do that again. This is done with anesthetic, of course, managed from there. So if you just did one of those all three of those procedures in 1 month, your billing will be, ta-da, next slide. Abby, next slide. There we go. $3,275. That doesn't seem like too bad to make a $2,000 payment. I mean, you're ahead and a little over $1,200 in that month for just doing 3 procedures. So people look at this and go, "Oh, do I need a laser? Don't I need a laser?" You know, I haven't even talked about perio, and periodontal procedures is huge and to manage from there. So next slide. And then if you start, some practices that do preserves will be doing laser assisted periodontal therapy. That runs about $800, some places to $1,200 a quad. And again, that can be done in-house from mild to moderate. As you're prepping teeth and you're prepping your your crowns, and the tissue is bulky in your way, we have to trough it out of the way and do a minor gingivoplasty. That is now a billable code. That's a 4212. That's $50 in our practice. You're doing biopsy? Perhaps you are. You can use this for biopsies. Tongue releases, as I mentioned. Implant debridement. In our practice, when we see peri-implantitis and we're starting to lose some bone, we have to know how to debride the implant. Again, this is a D499. This is a patient pay code, but we charge about $200 to debride the implant. When we're doing endodontic therapy, we have a fee, which is $225 for laser debridement. We use our laser to help clean the canal. Excision of hyperplastic tissue that's overgrown and the likes. Again, that's a billable procedure at $375. So I'm just giving you some ideas on what happens throughout your month and in our dental practices to see that there are billable places that you can go. At the same time, not only are you doing things that you maybe aren't doing, but your procedures will be a little bit faster. With proper control of the tissue, you're going to find that you'll be doing more procedures per unit of time or multiple procedures per unit of time. And this is just an example. I mean, how long does it take you to take off a veneer or a crown? I mean, a veneer pops off with the laser therapy, with an erbium laser, sometimes within a minute, as opposed to cutting it off. And we can remove zirconia crowns, Emax crowns in sometimes 3 to 4 minutes. All right. So again, these are things that you look at through the course of the day. It makes your day flow much smoother at the same time. Next slide. Just to give you a few ideas on a few other aesthetic procedures, in case you'd like to do aesthetic procedures. Of course, aesthetic procedures are not covered by insurance, but practices are doing them on a regular basis. One is, next, gingival depigmentation. In this case here, this young gentleman had some darkening of his gingival tissues, and I've had some patients that are very pigmented as alike. We can use this laser with topical anesthetic to remove that pigmentation permanently. The next slide shows him what he looks like next day. Again, no pigmentation. So we'll get to the bottom one following that. Secondarily, is that if you like, go ahead, next slide. Thanks, Abby. If you want to get into more of the aesthetic zone, more being more of a dental spa type thing, BIOLASE also has a fractional handpiece that goes with the lasers. Next one. Next slide then. And in this case here, with facial resurfacing, we can remove pigmentation, good for acne scars, also helpful to help remove some wrinkles, helps regenerate collagen in the area. Sometimes in doing this, if it's over 3 or 4 sessions, that we get great results and the patients don't even have to go for Botox if they don't want to. So again, this is a younger patient that was done by a good friend of mine, Dr. Harnoy. And here you can see how the skin tones improved immensely. For something like that, it's an aesthetic procedure. It's a cash procedure to the office. And again, I charge $2,500 for 3 sessions. and getting great results as well. And you do not have to use any anesthetic to do this as well, which makes this a great option compared to the other options to do this in the marketplace today. All right, next slide. So my suggestion would be is that now I'm sure you have a few questions both on how to purchase this, how to get that tax deduction, and now I've kind of shown you how to pay for it. Again, we're here to answer your questions and put them up in the chat if you need to be, and we're available at any point in time, and you can get a hold of any of us through the BIOLASE company. Thank you very much for your attention.
All right, thank you, Alex and Dr. Brad, for some very insightful information here. Do we have any questions?
So I'll jump in with one. I don't see any in the chat yet, if you guys can hear me. This is for Alex on the Section 179. Is there a difference between the Section 179 this year versus what's going to happen in 2026?
It's a good question. So as we all know, the IRS can change the rules as they want to go for it. And at this point, we are being told that next year is going to be dropping down. Now, I want to talk bonus depreciation. There's not going to be a change at 179. 179 does go down on an annual basis. Next year, I believe it's 30%. But for bonus depreciation, which was the big change from last year to this year, bonus depreciation last year was 40%. Bonus depreciation this year is 100%. Bonus depreciation next year is set to go down to 60%. So the important part for that is that by putting the equipment into service or to make the contract this year, you're literally going to have a 40% benefit for buying it this year versus next year.
Thank you. Any other questions? Put your questions in the chat and Javier will get to those.
Yeah, I have the chat open. I don't see any questions so far, but please feel free.
No.
Anybody? Free advice right here.
I think the biggest thing while we're waiting for questions is just to know that, these are always ongoing changes. And the biggest thing is don't be afraid to reach out to BIOLASE, ask the questions, and put it in practice. I mean, it's really one of the things that they put the bill in place in the summer to help stimulate the economy. And it's either invested in your practice and in yourself or, pay it to somebody else.
Well, I always like working with somebody else's money, so I think it's a great idea. I'm gonna look at our practice. This year, now that you said that, we've already made some capital purchases. So there's no maximum per year of how much you can spend this year? Is there a limit? Oh, Alex, you're on mute now.
Tap to unmute. All right. Hopefully I'm unmuted. I apologize.
There you go.
Great question. So it's 2.5 million is the cap for the bonus depreciation. So again, I think the biggest thing is with the bonus depreciation over 179 is you can cause a net negative for this year that can be carried on to next year. To me, that's the biggest benefit, in my opinion, is to be able to take that advantage this year and carry that ongoing advantage till next year.
And all you really have to do is just have a signed contract by December 31st.
That's correct.
Oh, that's pretty sweet. Yeah, I'm gonna start looking. Thank you.
Questions. But thank you so much.
Great.
Thank you, everyone. And
thank you all.
Great evening.
Yeah, everybody have a great evening. Be
Y'all
safe.
too. Thank y'all. Bye-bye.